Welcome back. We're at the Hilltop Pet Clinic, and I'm with Dr. Brandon Beabout. We asked you to ask the vet some questions, and we got a couple for Dr. Brandon this morning. First of all, the first question is, what does a basic health exam include at the Hilltop Pet Clinic?
So that first pet exam is a very important one. We go over a lot of information there. First and foremost, fill out your paperwork. We know what breed, how old we are, coming in to see us the first time. We want to get to know you, see what you guys do in your career, develop some rapport, then get to know the little guy. We ask questions, don't make eye contact the first little bit as we are talking, letting that pet get comfortable in this new environment, just like us at the first time when we go to the dentist. And then we kind of move on into where we are with vaccination status, deworming, preventatives for flea and tick. We do the examination, tip of the nose, tip of the tail, mentation, making sure that our teeth, our baby teeth are falling out appropriately, our adult teeth are erupting appropriately, looking for any congenital abnormalities, so present at birth. We kind of talked about this with Harley, making sure that heart is strong, no murmurs, anything like that. Looking for umbilical hernias. We see that very, very commonly. We look for congenital orthopedic abnormalities, and so patellas or kneecaps that like to slide in and out, we'll see in young puppies. And so we just kind of gather, is this new puppy in good health? We establish that, and then we look forward to, where do we go in the first few months of our life, the vaccine boosters, getting the spay and neuter done, and then even talking about long-term insurance, and saying, are we protected for any injury or illness going on forward. So
now, does the pet owner stay with the pet then when they're in for the exam?
For the first exam,
okay.
Absolutely. We do a number of drop-offs and things like that. But that first exam, I bombard you with information. I want all the questions that you guys may have answered, so we really establish a good cohesive relationship.
Okay, because that kind of leads on to the second question, which is, how do you know if your dog is obese?
So, ask your vet for sure. Come on in, and honestly, there's a statistic about 80% of dogs are technically overweight, and essentially, I tell folks, when somebody comes over to the house and sees your dog and asks you why they're so skinny, you're probably doing something right. They're probably on par. It's very common for us just to see the rib coverage and say, oh, this dog's at an ideal body weight, when actually they tend to be overly lean, perfectly plump, I call it. And so we have a body condition score, 0 to 9, 5 is ideal, 4 is lean, 3 is thin, 6 is that perfectly plump. And so we can kind of give you an idea, hey, this is where we are, this is where we'd like to go. And I will calculate beyond the chart on your bag of food, as far as how much to feed. We will actually calculate the number of calories, and there's a little number on that bag of food that has that calories per cup, and so we know exactly how many cups of food to feed that kid, and then they may calculate it and say, oh my gosh, I'm feeding 1.5 cups too many over the course of the day.
So this goes along with that. Table scraps, good. I mean,
so in moderation, my kids are definitely know what table scraps are, but we are ensuring that their calorie content or intake is the correct amount throughout their lives, so we are able to do that in moderation, obviously.
Okay, so a lot to think about. Lots to think about. All right, thank you, Dr. Brandon. Join us again next Monday for another edition of Pet Doc.